A general practitioner, GP, is a doctor who is a consultant in general practice. GPs provide personal, family, and community-orientated comprehensive primary care that includes diagnosis, continues over time and is anticipatory as well as responsive. GPS have distinct expertise and experience in providing whole-person medical care, whilst managing the complexity, uncertainty, and risk associated with the continuous care they provide. GPS work at the heart of their communities, striving to provide comprehensive and equitable care for everyone, taking into account their health care needs, stage of life and background. GPS work in, connect with, and lead multidisciplinary teams that care for people and their families, respecting the context in which they live, aiming to ensure all of their physical health and mental health needs are met. They are trained to treat patients to levels of complexity that vary between countries. The term primary care physician is used in the United States. A core element in general practice is continuity of care, that bridges episodes of various illnesses over time. Greater continuity with a general practitioner has been shown to reduce the need for out-of-hours services and acute hospital admittance. Continuous care by the same general practitioner has been found to reduce mortality. The role of a GP varies between and within countries, and is often dependent on local needs and circumstances. In urban areas their roles may focus on care of chronic/complex health conditions, treatment of urgent/acute non-life-threatening diseases, mental health care, preventive care, including health education and immunization, screening/early detection of disease, palliative care, care coordination/referral to allied health professions or specialized medical care. In rural areas, a GP may additionally be routinely involved in pre-hospital emergency care, the delivery of babies, community hospital care and performing low-complexity surgical procedures. 3-4 GPS may work in larger primary care centers where they provide care within a multidisciplinary health care team, while in other cases GPS may work as sole practitioners or in smaller practices. The term general practitioner or GP is common in the United Kingdom, Republic of Ireland, Australia, Canada, Singapore, South Africa, New Zealand, and other Commonwealth countries. In these countries, the word physician is largely reserved for medical specialists often working in hospitals, notably in internal medicine. In North America, general practitioners are primary care physicians, a role that family doctors and internists occupy as well, though the American Academy of General Physicians, AAGP, the American Academy of Family Physicians, AAFP, and the American College of Physicians, ACP, are distinct entities representing these three respective fields. General practice is an academic and scientific discipline with its own educational content, research, evidence base and clinical activity. Historically, the role of a GP was performed by any doctor with qualifications from a medical school working in the community. However, since the 1950s, general practice has become a medical specialty with additional training requirements. 5678 The 1978 Alma Ata Declaration set the intellectual foundation of primary care and general practice. General physician, GP, is often called a general practitioner. A GP specializes in family medicine and are qualified to provide treatment, prevention, and cures for a wide range of physical and mental problems regardless of a patient's age and gender. They perform routine screenings for certain health conditions and provide lifestyle recommendations and follow-up care for chronic conditions such as high blood pressure, risk factors for heart disease, risk factors for diabetes, high cholesterol, cancer, sexually transmitted diseases, depression. General physicians can also treat acute, short-term, conditions, such as minor wounds, asthma attacks, migraines, urinary tract infections, colds and flu, fever, dehydration, minor broken bones, skin infections or rashes, muscle strains and sprains. In case of a mental health crisis, your general physician can connect you with a mental health specialist. You can now book a tele-appointment with the best general physician in Karachi at Memon Medical Institute, MMI. Reasons to consult a general physician. You can visit your general physician to discuss a variety of health concerns, from cough and cold to fever and migraine. Some of the reasons to consult your GP are: if you have a persistent high fever. Fever is one of the ways your body fights infections. But if you have a fever above 39.4 degrees Celsius, 103 degrees Fahrenheit, or a fever that lasts longer than 3 days, you should consult a general physician. If you have a cold and it becomes bad. If your cold doesn't disappear or gets worse, seek general physician help. A cough that lasts more than 2 weeks can show symptoms of whooping cough, while untreated congestion can lead to sinus infections. It is best to consult a general physician. If you lose weight suddenly or without trying. Unexplained weight loss can be caused by a variety of different conditions, such as depression, liver disease, diabetes, or an overactive thyroid. If you've been experiencing unexplained weight loss in the past 6 months, and you're not overweight, make an appointment with your general physician. If you experience shortness of breath. If you experience shortness of breath, visit a general physician and ask about the possible causes. Shortness of breath may be symptomatic of asthma, bronchitis, or other illnesses. Lack of air can also be related to stress, anxiety, and panic. If you have pain in the chest, abdomen, or pelvis. Abnormal, intense, and permanent pain in the chest, abdomen, or pelvis can indicate serious problems that require immediate medical attention. For example, chest pain usually means a heart attack, abdominal pain could mean a presence of gallstones or appendicitis, and pelvic pain might mean a kidney infection. Changes in bowel movements or urination. Bowel movements and urination vary from person to person. A sudden change in your pattern, example a bloody or black stool, diarrhea, constipation, or excessive urination, should prompt a trip to your general physician. If you have any confusion or changes in mood. Mood changes and confusion can be symptoms of mental illness, such as a side effect from an infectious disease or drug interaction. Be on the lookout for problems with thinking or focus, abnormal sleep patterns, and anxiety or depression. Finding a good doctor that you can build a relationship with over time is the most effective way to manage your health. You may need to visit a few different doctors before you find the one that you like and feel comfortable with. Over time, the general physician will also get to know you and become familiar with your medical history. To simply answer the question of what is a resident doctor is someone who has recently graduated from medical school and is completing their postgraduate training. In comparison, an attending physician is a board-certified physician who has already completed their required residency program. Resident doctors are supervised by attending physicians. When a patient receives care from a resident doctor, they are also receiving care from the attending physician who is supervising the resident. The patient will benefit from the knowledge of both the resident and the attending physician. This article goes into detail about what defines an attending physician and a resident doctor, as well as offers a breakdown of the other care professionals that make up a hospital's care team. Doctors and levels of seniority. There are various financial aspects to consider when taking the MCAT, from the cost of registering to travel expenses. Later in this guide, we will discuss the various ways to minimize the cost involved with taking the MCAT exam utilizing low-cost prep materials and the AAMC Fee Assistance Program. Not all of these cost-minimizing avenues are available to all students, and for the average student, the exam is a significant expense that they must budget for. As you plan your med school application, keep in mind that you will have to spend more than time and effort to prepare for your upcoming MCAT exam. Doctors and levels of seniority. To develop an understanding of what a resident and attending physician are, it is important to understand the different levels of physicians and their key differences. In a United States hospital setting, this is the typical hierarchy of doctors. Attending physician, a doctor/physician who has completed postgraduate training. Fellow, a doctor who is pursuing optional additional training after completing their residency program. Resident, a doctor who has completed their first year of postgraduate training. Intern, med school graduates who are first-year residents. To become an intern, you must complete your formal medical school education and then embark on further training at a teaching hospital. For medical students in the United States, you can take part in the NRMP, National Resident Matching Program, to find the best residency program for you. Attending physicians. Attending physicians are medical doctors who have completed all necessary residency training. They are board certified and/or eligible to practice independently in their specialty. An attending physician often supervises fellows, resident doctors, and medical students. Attending physicians may also be medical professors at an affiliated school. They have the final responsibility for all patient care even if a fellow or resident doctor provides the patient care. Attending physicians may or may not have legal liability, depending on the circumstances. These physicians are considered to be experts in their designated field of medicine or surgery. They are also referred to as attendings, staff physicians, or supervising physicians. Depending on the field of medicine, the path from being a medical student to becoming an attending physician may take 7 or more years. Some medical specialties can take 14 years to complete all needed undergrad and graduate studies plus the required postgrad training. If you feel you may need more guidance about what medical specialty is right for you, International Medical Aids Residency Admissions Consulting Services can help. Our consultants work one-on-one with students to help them find the best path for them. Fellows. A fellow is a medical professional who has completed their residency and chooses to pursue further specialized training. A fellowship is optional but is required if you want to practice within certain medical subspecialties. An example of this would be a general surgeon who wants to practice pediatric neurosurgery or cardiothoracic surgery. There are fellowships for many medical fields, including cardiology, neurology, obstetrics/gynecology, ophthalmology, orthopedics. Intern vs. resident. Medical school graduates enter into a residency program at a clinic, doctor's office, or hospital. The goal of a residency program is to continue training in a specialized field of medicine. Most medical residencies last between 2 to 3 years for fields such American Samoa family medicine and upwards of 7 years for surgery fields. First-year residents are often referred to as interns. After completing their first year of residency, they are referred to as residents or resident doctors. Resident doctors provide direct care to patients under the supervision of senior residents or attending physicians. Residency specializations. Resident doctors can choose different specialties to train in after graduating from medical school. Some of these specialties include emergency medicine, general surgery, family medicine, pediatrics, anesthesiology, diagnostic radiology. Chief residents. Chief residents are chosen to lead a group of residents. These residents are elevated to a level that puts them senior to all of the other residents, but junior to the program's management. Duties of chief residents can vary but often include patient care, training, mentoring, carrying out select administrative duties, and advocating for team members. Chief residents are chosen by hospital leadership during their residency training program. Medical students. Med students are those who have completed their undergraduate studies and have been accepted into a university's medical program upon meeting all necessary criteria such as passing the MCAT and AAMC core competencies. Medical students spend the first 2 years of their med program primarily in a classroom setting. The last 2 years of med school require students to spend a lot of time in a hospital or other clinic-based setting. After completing medical school, students will either graduate with a DO or MD degree. For more information about the differences between MDs and DOs, only after graduating can they be referred to as physicians, even though they have yet to complete their residency training. How to identify who's a fellow vs. resident vs. attending. Sometimes you can identify where a doctor ranks in hospital hierarchy based on the length of their lab coat. The shortest white coats are worn by medical students, with residents having slightly longer coats and attending having the longest lab coats. However, a lab coat is not always an indicator of someone's rank as a physician, as other medical professionals such as phlebotomists and nurses wear lab coats. Today, the majority of healthcare workers wear scrubs instead of lab coats. If you are in doubt about someone's title, it is best to refer to their ID badge or simply ask them. Those who are training to become physicians receive different titles as they progress in their education and climb the ranks. They will start out as medical students, then interns, residents, and fellows before becoming attending physicians. From when they enroll in medical school to obtaining their board certification can take anywhere from 7 to 14 years, sometimes more. Are you an aspiring physician but you're unsure how to start the process of applying to medical schools? IMA can help. We offer a variety of great resources for medical students and those who have yet to apply to med school, from our admissions consulting to pre-med shadowing, study abroad programs, and the plethora of helpful medical school guides. Thank you for watching this video.